into some stories that we want you to interact with. So this is where you get to be the what about question askers, and your speakers are going to tell their story and try to get it told before you ask them. Totally derail them with all your what about questions. So get ready. All right, we're going to start with Kenny. And Kenny, you want to come on up or you want to sit there? It's up to you.
Can everybody hear me okay if I stand? I speak a little better standing.
There you go.
Is that good? I'm Kenny Moore. I'm the Project Management Officer for the California Department of Public Health. My success story is about trust as a foundation for change. And the example that I'd like to use is a project that's in its early phases in our department to establish a statewide immunization registry. And my department and its predecessor department have tried to do this project 3 previous times, starting in the 1990s. And each time the project ran into challenges. Projects always run into challenges, but the challenges weren't managed well enough. They weren't resolved, and they derailed the project each time. Historically, we did not have a real good trust relationship between central IT, between the PMO in specific, and all of our various very highly driven business programs. There, in the toolkit that each of you will receive, there's a little summary of a book by Stephen Covey and Rebecca Merrill called The Speed of Change. And it conflates trust with credibility. And it shows that as trust increases, credibility increases, speed of change increases, cost of change decreases. So in 2007, my department was created. We had new leadership. New leadership set out to establish a new culture. And in the last 7 years, we've really worked hard within IT to establish that foundation of trust with each of our business programs. And the summary that I mentioned lists. It has a list, I think a little over long list of key trust behaviors. There's 13. But 4 of them really jumped out at me, and they were listen first, speak straight, demonstrate respect, and deliver results. And those things jumped out at me because they're the very things that we've worked hard over the last 7 years to do every day to earn the trust of the business programs. And I'm really seeing it, the project, the immunization, first of all, we really need a statewide immunization registry. My understanding is right now we have one for dogs. We don't have one for children. So if a family moves from one part of California to another part of California, Fido's immunization records stay up to date. Little Johnny might miss an immunization that would protect him against a preventable disease. Little Susie might have to get an extra shot that she didn't really need. So we need to be successful. And I'm very confident this time we will be. The project is early, but projects always run into challenges, and this one is. But this time, the change is being managed. The challenges are being managed because, in large part, I think because we've done a good job of continuously improving, and we're still working on it. We work on it every day to continuously improve that foundation, that level of trust, so we can work well together. Yes?
Could you repeat those 4 again?
There's Covey and Merrill point out 13 key trust behaviors, but the 4 that jumped out at me were listen first, speak straight, demonstrate respect, and deliver results. Yes?
I think I'm not clear on the why. Currently, I think the state does a very good job of getting information out there to parents regarding immunization.
Mm-hmm.
Of course, it's a voluntary topic, and we know that. And we put information, the PM286s are out there for preschools, all of that.
Right.
Why do we need government then to manage that instead of the parents?
That's a good question. Not all parents are as great as probably you and I are at doing this. One of the reasons, there's a lot of reasons. One of the reasons is for the epidemiologists within my department to be able to gather data for immunization forecasting. If there were to be an influenza pandemic, how many people have already been vaccinated, how many more vaccinations would be needed. So one of the things an immunization registry, a statewide immunization registry will do, will be able to provide that information. It's also a way that when your child enrolls in school, it gives one place where the school can quickly and easily verify that the child has the immunizations that are required. Yes.
Did you guys look at seeing if you could use the dog registry?
There were. I think we looked at it briefly. There's apparently enough differences between dogs and children that it wasn't the way to go. There's actually a very good public domain system that's been implemented in New York, in Wisconsin, in Oregon, several other states, including big complicated states like California, that works really well. And so that's the one we're going with. It's called the Wisconsin Immunization Registry. I'm not sure who's next. Yes.
It's good to sit in the front, huh? So I'm looking at what's in it for me. Do you have a formalized plan for socializing this idea proactively with your other partners and the public?
Yes, the business program does. They're doing a real good job of communicating out, and the regional immunization registries are on board. They really want this change, so it's going to be easy. I think the change is always easier when you don't have to sell it. And everybody sees that everybody involved sees that this is needed.
Thank you.
Yes.
So when you've been doing your planning and your parents gathering, my question is, what about parents that don't participate?
We don't like them. Yeah, a big part throughout my department that public health is about influencing behaviors, and so it's about. I mean, parents have that right. You can decline to have your child immunized, and through education, I don't know. I'm not really the focal point for that part of it, but I know that the department works hard to influence those behaviors and to show people that the benefits of. And it doesn't take that many. It's like something like 5%. If 5% of the people go without immunization, you can have a pandemic.
What are you doing differently now to keep the project rolling versus in the 90s? You said you had tried earlier.
It's really been a process over the last 7 years. We're really not doing any particular thing differently. It's just that since 2007, under my predecessor, we've worked hard every day to be a service-oriented organization and to demonstrate to our business program partners that we're a success partner for them. We're not just a government agency. I mean, I think everybody that's involved in state projects know when a business program has something that they need to do, they really want to move forward with it and they want to get it done. And part of our job is to make sure that all of the state processes that have to be done get done. And we've been viewed historically, at least in my department, as that role as kind of a governance agency, kind of a cop. And we do still have that role, but we really want to emphasize that we're there to make the project succeed. And who's keeping track of time? How am I doing on time? Okay. Yes.
Why a new registry? With the federally mandated Electronic Medical Records Act, why not leverage some piece or part of that?
This is leveraging that. The statewide, it's a big part of it. The HL7, it's actually this project will then be leveraged to provide the electronic medical record piece for the cancer registry, for the childhood lead registry, for the other registries in the department. So yeah, we're definitely looking at that. We're doing that. Maybe time for one more? Or 0 more? Even better. Thank you. Oh, yes.
What efforts are being made on the privacy side of that?
I know that it's being addressed. Our information security office has a very comprehensive list of requirements that we apply anytime there's privacy concerns. And like I say, the system that we're doing has been implemented in a number of other states. So we have lessons learned that we can leverage. I wish I had a better answer. I don't really have expertise in it. I know that it's being done.
Just really quickly, are you looking at mobilizing this so that parents can have this information readily available on their smartphone? If they were at school and they're registering a kid, they can pull out their phone, here it is, they can get the records or transfer the records through their application that's being built?
I don't think so. It's a great idea. I'll bring that back.
Another thing that applications do is they allow you to collect the metadata from region, where they're at, and that would allow you to create a heat map of DPT or polio vaccine or lack thereof.
Excellent. I'll bring that idea back. Thank you. I think I need to, yeah.
Ready to go.
Thank you.
So Andrea.
I'm next.
Yeah.
So I'm going to do my best not to drive your cameraman crazy, because I don't stand still, nor do I sit. So, I'm Andrea Wallin-Rohmann. I'm the Chief Deputy Director for the Department of Technology. And prior to that, as Bill had indicated, I had been with the Department of Corrections, and I'd spent about 20 of the last 24 years with the Department of Corrections, working in and around business and IT. And because of that, I ended up on this really cool project called the Business Information Systems Project. I started on that project back in about 2004 directly. And what I'm going to talk to you about is change management nightmares. Not because I didn't know what I was doing in change management, because I am a professor in change management now. I walked into the project much like many other people do, right? I walked in as had been a manager one special assistant in the finance division to the person that was the project's executive, the executive sponsor of it. Really didn't know what project management was, other than that I surely quickly found out that really the way I ran everything in my world was through project management. I just didn't know that's what I did, right? And so I took on this project. I came from the business side. That sounded like the greatest thing in the world, right? I was a business person coming in to drive this business information systems project as the project manager. And that probably turned out to be one of the greatest change management challenges that project had. Because everybody on the business side said, she's got it. Andrea knows our business, right? So when you're going out there and you're asking for subject matter experts and you're saying, look, I need your best of your best, number one need, right, in change management, right? They're going, you got it, you know what you're doing here. So we had an FSR that was approved in 2004. That's when I walked into the project. So I came in what I thought was at the good time of a project, because we're done with an FSR, right? I didn't know that between that point and the time I would eventually leave the project, we would write 7 or 8 FSRs. Wow. Yeah, I'm a queen at writing FSRs. If you ever need help, let me know. And what happened during the course of time was, in 2005, we had this crazy thing happen in our department, which was a complete organizational change. And we went from being the Department of Corrections to a agency, and it was corrections and rehabilitation. And we went from being just about the adult side of managing inmate population to incorporating adult and youth. And so we had to, midstream, while we were in the middle of developing procurement documents, go in and rebuild in, are you moving me? Oh. The mic.
Once it
Oh.
turned off.
Do something with that mic.
We got it.
I didn't ask for sign language. But so what we had to do was midstream, we had been out meeting with all the institutions, right? Because the first thing I said was we're going to go out to talk to the people. We're going to talk to them about what this project is, what this thing is that we're talking about procuring, how we're going to change the way they do business and managing the business side of a prison. So we went out to every one of the prisons and we did a road show. And it seemed like it was the greatest thing to do. And then we came back and they said, oh, time out. Go and include all of the youth authority organizations, right? Which at the time they were called youth authority. And so we said, okay, that seems pretty easy, except we thought we had 30-some different processes that were used in the prisons. We now had to bring in about 6 or 8 different processes in the youth side. And we had to make everybody feel like they were equal, right? Because the big change issue in the Department of Corrections, if you know anything about them, is that the big gorilla drives everything, and the poor youth authority always feels like they're just the flea on the tail of the dog, right? So we had to midstream halt that, go back out, go out and do some more analysis sessions and as-is business process designing and all that kind of great stuff to build into the procurement. So that was the first big change issue that we ran into. So we come back and we think we're going great, and we get hit with this thing called the receivership. And all of a sudden we're told, get healthcare out of your solution. Healthcare isn't going to be a part of your solution. They're doing their own thing. They don't need you. They don't want you. They're going to build their own administrative system. So redefine your entire project, get them out, get all their requirements out, and make sure that everything that you have now defined is strictly meeting the adult and the youth prison management. Okay, great, so we did that. We started going forward and we procured. And we get told, as we're designing now and developing the solution, we get told, stop, receiver wants back in. So stop what you're doing, go talk to them, figure out what you need to do to the design that you're doing to bring them back in and make this about both of you. Well, if you know anything about healthcare management, you know that the way you do healthcare management is different than the way you do inmate management, even from the business side of an organization, right? So that was the next big change issue that we ran into. And so we did that. And we thought we were doing everything really, really well. Except a few things we realized once we deployed the first big piece of it, and that was that everybody was focused on one really important thing, and what do you think that was? What are you always focused on when you're trying to do an implementation on a project? The date. On time. Date, right? We're going to hit that date. We said we're going to implement by God. I don't care what it takes, we're going to implement, right? So they did. They implemented. And by then I promoted to the CIO, so I was not directly on the project. But I was still kind of had my hands in it because it was like my baby, right? And so we find out that the business hated it. And they hated the project and they hated everything about it. And why? Because they said nobody talked to us. And we said, yeah, but we did, and we asked you, and we've engaged you, and et cetera, right? And they said, well, but we didn't send you the right people. Right? And that occurred in every line of business. So in your procurement, in your contracts, in your budgeting, in your financials, in your human resources. And it really took about another year for us to kind of do a timeout pause and say, okay, you've got something out there, limp along with it. And we're going to go back out, we're going to meet with you, we're going to talk to you about what needs to be done, and we're going to try to fix it. And so at the end of the day, we did just that. And we went back out and we met with them and we made small adjustments here and there. And interestingly enough, went through a process that we all hear about now and we kind of cringe on called Agile. But really we ended up taking what we had initially started off with the waterfall implementation, and without knowing that what we did was kind of do an Agile end implementation in order to fix what had been deployed, right? And we had to do that because at the end of the day, we needed it to be successful. And we needed it to be successful because in that particular department, we needed to have a better management structure, a better management system for how we could make decisions around spending money. It's an $8.5 billion department. If you look at that in the context of how we spend general fund dollars in the state of California, it's a large chunk of your general fund dollars, right? And it's a lot of money to spend. And if you can't fully answer and explain what you're spending that money on, how you're spending it, what it costs for us to manage an inmate, it becomes very problematic in a department of that size. And so we had to fix it. But so if there was any potential change management nightmare you could hit, we hit it. The reality is, at the end of the day, we overcame them, and maybe that's the best part of the story to give you, right, is that you can overcome them. But it's how you go about overcoming them. You know, you heard Kenny talk about trust. Trust becomes critical because that's key in how you're overcoming it, right? It's absolutely okay to raise your hand and say, hey, apologize, it didn't go so well, we need to fix it. You need to work with us, we need to fix it together, right? Because at the end of the day, and probably the hardest thing that our organization learned was that IT doesn't drive anything as an organization. IT as an organization drives absolutely nothing. Business drives everything. IT is a catalyst to make it all possible, right? And as IT professionals and project management professionals, the quicker we get that particular concept, the more effective we're going to be in going out there and driving project, because everything in IT is change. So everything we do is about change, right? It's about making something different in an organization, and so that becomes the key component of it. So with that, I turn it over to you for any questions. We just have a couple of minutes, so I apologize for that. But yes.
What did you do in your experience when the driving mechanisms, the business side, has the philosophy and core belief that we don't need to tell you anything in IT about what our business is? Just stay the hell out of what we do.
So we hit that. We covered that in a couple ways. It was probably just happenstance, but one of them was I knew them because I'd worked in their world for a really long time. Right? I'd worked in budgets, I'd worked around the financial division, and I'd been in the procurement arena, and so I knew who to go grab and say, no, come on, look, we got to know, right? The other was that I recruited in really smart people that work in those areas in the prisons because I had connections into the prison operations. So we had at least, the problem was, once they came into the project and became a project employee, guess who they were no longer? The business, and the business disowned them, right? The piece I forgot to add was I had 13 different executive sponsors in the course of about 6 years.
Wow.
So I'm telling you, it was a change management nightmare, but yeah. The other way that we did it, and this was kind of happenstance, HR was another area that just drug its heels, and it drug its heels until about 2 years ago. And the only reason it turned was because I went and became the deputy director of HR. And my first message to them when I greeted all of the employees of HR was, if you think you're going to be visitized, you will. So let's just get that out of the way right now. Let's be very honest up front. You will become visitized. You will learn it. You will like it. And we're going to figure this out together. But it's going to happen. So that was the other way. Yeah. Any other questions? Yes.
I just had a question about, we have all been taught that project success is when you're within 10% of scope, schedule, or cost. So your schedule was not changing. You had to implement by a certain date.
We ended up blowing schedule completely out of the water by the end of the day.
You did. But yet you still say project success, and I think that's where we need to change our mindsets. That we got to think outside of the box and still label it as a success, even if we've had to make those adjustments.
Absolutely, and I would agree with you. And even in my current capacity, I would agree with you. We have to find a new way of defining what is project success. We did bring it in under budget, surprisingly. We blew it out, scheduled probably by about 2 or 3 years. I can't remember anymore. But the budget stayed intact because I had a really good relationship with the contractor and said, look, we're in this together. You need this as bad as we do, so work with me, right? And I had a good vendor, that was involved in this. But we did blow schedule significantly. But so I agree with you, and I think that's one of the things you're going to find will start to change a little bit is how we define success. The challenge we have on that is the external partners we have, right? The legislature, Department of Finance, and et cetera, and helping to educate them and understanding what does success of implementation mean versus success of project.
Yes. Don't you feel that if as long as you can explain what it is that's happening in a way that makes sense, like it makes sense to implement the healthcare part in because it's an administrative services tool basically. So that made sense. So taking the extra time blowing out your schedule to take the extra time to include that into your project, it makes sense. And so to me, it sounds like that's where your cost savings is, because rather than building 2 systems, now you're building one, and you're only training one.
You know, and if all we ever had to do was worry about making sense, we'd be in much easier. But the reality is writing SPRs is what we do, right? I mean, we write SPRs to make everything make sense and make it look pretty at the end of the day. And so reality is we're working on that. That's everything that the STAR project, if you don't know what that is, but everything that that's about is really re-looking at how we even do project approval and how we then go forward and looking at when projects are or aren't successful. Yes?
And I think in some ways, what you said almost sounds as though the art of managing change management was taking the center stage in the fact that you said you had an FSR, and then you wound up having to write several FSRs after that. And so now you can stand up there and say, yeah, we were successful. So in reality, wasn't it a case of, as was said earlier in the keynote, about checking the vitals and going back through and tailoring the project down so that way you can be successful? Because if you were to measure the success, wasn't it actually a failure on that first FSR because you had all of the others, but instead you utilized the, intelligent disobedience, whatever it was, to go through and say, this is the true need. When you took a look at the business end of things, this was the true need of the customer. And all the experiences we garnered along the line, having us develop these FSRs, all this stuff, we actually identified the true business need, and we were successful in providing them.
And I would have to agree with you, and I think intelligence, was it obedience or disobedience?
Disobedience.
Intelligent disobedience is probably your key, right? But it's also where I say that we went from being a traditional waterfall type implementation to really an agile, right? Because that's really what your agile kind of yearns to, is breaking it down into smaller chunks, doing smaller pieces, doing, getting smaller wins more often, and then recognizing an end goal. And that's really at the end of the day what we ended up doing, right? We started off with a big bang, and I fought that we do not want a big bang, but we were going big bang, and then they came in and said, wait, stop, do big bang by function. And I said, that's okay, I'll do that, I'll do accounting. And then they said, wait, let's just do pieces of accounting by region. That was another change nightmare, because you had 2 different accounting systems in your organization running different parts of your prisons for about a year. So you ever want to sit down and have, I don't drink coffee but water, and talk about really change nightmare, I'm happy to have that conversation. But we hit everything. We hit every one of those nightmares, and it did become about the art of managing the change and about trust, because at the end of the day, if nothing else, the executive business would at least sit down and talk to me, right? Because they trusted that my goal was to get them something that worked for them, and whatever it took for me to do that, I was going to make that happen.
You mentioned a challenge with making one group feel as though you're as important. I think the other side of that can be the group that is perceived as being more important doesn't want that position challenged. So I was wondering, did you encounter that, and what did you do about it?
So we hit that in 2 different areas, because we hit it with the youth authority and then we hit it with healthcare. And so what we did on the youth side, which is now considered juvenile justice for those of you that are up in terminology in that department, but is they became a part of, so their entire admin organization became a part of the general departmental organization. So we didn't have 2 admin organizations. So that was one of the ways that we were able to do that. On the health side, they still manage and maintain their own separate admin operation. And it really meant a matter of sitting down and making sure that what we defined as processes in a system made sense as a process, period. And I won't say it's perfect to this day, because there's still, every day there's different things that they continue to improve on it. But it's a much better engine in terms of how they manage their business. But it really came down to saying, look, we got to kind of negotiate on things, right? And recognize that there's a process that we have to do things in state government.
Do you feel that, you said when they first told you that, they give you these people, and then later on they said, hold on, we gave you the wrong people. if they would have had the authority to buy in the beginning, you felt that there wouldn't have been a change?
I think if they, in some cases, we would have had better subject matter experts, it would have been better. I think if the business would have owned it from day one, right, and that was to me a big key, is that in the beginning, the business never had to own it, right? Because they put me in there and figured I was it, right? Except that the minute I came in there, something psychologically happened and they went, oh wait, but I'm okay as long as I'm making the decisions they like. When I'm not making those decisions, now I'm part of them, right? And you're not representing us anymore. And so it was a really bizarre kind of situation. It really took an executive sponsor by the name of Martin Hoshino, who's now the undersecretary on the adult side, or the whole security side of the organization. He was the executive sponsor on the support side in the end. And it really took him saying, you know, what do you need? And I said, here's what I need. I need you to tell every one of the business owners, you know, the executives, the directors and whatnot, or deputies in the business side, that their success is dependent on their organization's ability to adopt and adapt. That's what their success is defined. And he said, okay, I'll go do that. But it took somebody willing to do that. Yeah. So with that, I need to turn the mic over because I'm going to suck up all the time from Bill, and he has a really good project to talk about. So thank you.
All right, Bill Otterbeck, Assistant Deputy for the CAMUS Division. Does anyone here know what CAMUS is? Oh, go ahead.
California Medical Management Information System.
Medicaid Management Information System, thank you. So I'm also the contract officer, which means I get to deal with any of the sort of vendor oversight issues, and where we have disputes with the vendor, I get to resolve that with our contract management team. What I'm going to talk about is the fact that the CAMUS project is going through a system replacement. And for those of you who aren't familiar with Medi-Cal, we're administering essentially what health plans do. Providers submit invoices for payments for eligible beneficiaries, and based on policy, we make payments. So we pay out about $330 million a week. So we're high volume. If things don't get programmed correctly, it's high impact, right? So we have to have very accurate controls and system programming. So we have embarked on a system replacement project that will be deployed over 5 releases and over multiple years. And we started out with a software development lifecycle that was waterfall, your traditional approach, right? And much like Andrea was referencing, we realized that there were some conflicts between how we were approaching software development and doing specifically requirements development and the originally identified software development approach. And quite frankly, last summer, we went through a couple of months of struggling and trying to diagnose why are requirements taking so long, why are we struggling in this process, why does there appear to be a lack of clarity at the team level? And so we had to have a whole range of conversations. And what I like to tell folks on the team is it's not just one conversation. You got to have 100 conversations to figure out what's really going on at the team level and at the organizational level. And you know, just a tidbit about leadership. Leaders don't like to admit that they don't know the answer to something, right? And we went through a little period of time where, you know, we were asked, why are we struggling? And the answer was, we're not sure. We don't know. We're trying to figure it out. We're trying to ask the right questions of the team and of ourselves. But ultimately, we got to the point where we realized that the process that we set up in an RFP many, many years ago and that the vendor brought aboard was not working for what was a modified off-the-shelf product that they were going to implement for California. We weren't doing ground-up development. We were configuring existing systems to work for California policy and business need, right? And once we realized that, we started to have a conversation around Agile. And we reached the conclusion fairly quickly that an Agile approach made a heck of a lot more sense, and it would allow us to monitor and control the progress of the teams much more effectively. And so we made a choice in consultation with our vendor to shift to Agile, right? And so some of the themes around that I wanted to share with you are, one theme is transparency. The other is what I call end-to-end organizational change management. And what I mean by that is project versus program portfolio organizational change management. And the third theme is addressing project challenges with an organizational change management mentality first. So Vicki Sadie is my boss. She's the deputy director for CAMUS division. And when I first went to work there, one of our first conversations was around organizational change management. And we both felt strongly that we needed an organizational change management program in the division. We needed dedicated resources. I actually have someone here, Julie Murata, who's our lead on organizational change management. And we decided we needed some consulting resources to support that effort. And we took the approach that that had to be across the various projects. We have multiple projects running at the same time in addition to the system replacement project. But we wanted to make sure we had a consistent, thoughtful organizational change management approach. And the reason I mention that is, as we were making the decision to shift to Agile, we immediately started asking the question, so how are we having conversations with the team? How are we explaining the rationale for going down this path? How are we getting feedback from the team about whether or not this shift makes sense? And so we did it in a very structured way. We held all staff meetings, smaller group focus sessions, and a lot of individual one-on-one conversations about making the shift to Agile. And oftentimes when we talk about this shift, what you hear is, you train people up, you get the process in place, and then you get the teams running. And the reality is, it was a major shift for us. Folks felt a level of comfort and competence in the previous waterfall approach. They knew what that looked like. They knew you go to requirements and then you move to development and you do it on, what Andrea called a big bang approach. And people were very comfortable with that reality. Well, the reality is when you shift to Agile, you're doing much smaller chunks of work. You have a burn down list. The accountability really is at the individual and team level in working through those teams. And so the pressures and the approach felt very different for the team. And so we responded by getting training, getting an Agile coach, but we also implemented a comprehensive communication and feedback strategy to get the team on board. And anyone who would make this shift, it is a commitment of effort. It is 100 conversations, because as we talk about the why and the what about, we got all sorts of what about questions about, does this really make sense? What does Agile really mean to our organization? What is your we were introducing with Agile a whole new vocabulary of terminology, Scrum Masters and pigs and chickens, and the whole farm was there apparently. The transition didn't happen overnight, and the accountability at the individual level and the team level felt very differently. And so I mentioned in terms of themes, one was transparency, right? So as we struggled last summer, we were having conversations with oversight agencies, including the California State Auditor, and I would bet that I'm probably one of the few people that would include a California State Audit report in our toolkit, which I had done, because they wrote a report on our project, and it laid out some of the challenges, but it also talked about how is the department responding to those challenges. And part of that response was the shift to Agile. And the reason I make that point is, when we talk about transparency, part of transparency is sharing with our oversight agencies what are our struggles, what are our risks and issues, how are we responding to that, and is the response thoughtful, reasonable, and really getting to the root of the problem. And what I was encouraged by is when in reading the California State Audit Report, I think they understood the drivers for the change to Agile, and they really accepted the rationale and sort of the why of why we make this this change. I would say again, folks talked a lot at the project level, talked a lot about training. Training is essential to making this shift, but it's also making sure that people understand their roles within the sprint team methodology. And so we had individual folks who initially, early on, struggled with that. So we did do quite a bit of individualized coaching for folks to make it through that transition. I think there was a series of lessons learned, both from an organizational change management perspective, but also an Agile perspective. I think one of them is, and I think Brian, you touched on it in your remarks, is at some point, if things aren't working, you can't be afraid of saying, maybe we should do things differently. And fundamentally, that's what we did on this project. We asked ourselves, if we work harder, we work smarter in this process, are we going to be successful? And we went through a couple of rounds of, you know, are we really focused on the right requirements? Are the, you know, is this a skill set or subject matter knowledge challenge? And, you know, we really tried to make the original waterfall approach work. But ultimately, we concluded it wasn't going to work for us. And so that sort of early diagnosis, and I think in the plenary session, there was one of the sort of tests, the 7, you know, evaluation criteria is your ability to diagnose early and take corrective action. And for us, it was, we're not going to do waterfall anymore. We're going to make a shift to Agile. The other thing I would say is, when you're contemplating your pivot move, you got to have the people with you. Because if you pivot and start with a different approach, if we hadn't had really good team engagement, all staff meetings, you know, focus team meetings, individual unit meetings, and a good story to tell, and some answers as to why the shift to Agile made sense, because we were doing modified off the shelf versus a you know, from a ground up implementation. We had to have 100 conversations about why that made sense to get the team on board. And it wasn't just convincing them at the time we shifted to Agile and at the time we gave them the initial training. We had to have that reinforcement discussion, and that reinforcement discussion continues to this day. It's not something, you don't pivot and go, and then, you know, the month after the pivot, we're all good and just continue on and work hard in those 20-day sprints. It's a method of constant reinforcement, and to your earlier message, Brian, it's not just having the right message, it's listening to your folks, hearing what the concerns are, refining your message for the appropriate audiences, and updating it as your project evolves. Projects aren't static things. You hopefully get smarter over time. You're a learning organization. You're going to learn from your team, and you need to be able to answer smart people's questions. And I forget the term of art you used, Brian, reasonable explanation or whatever that was. You know, you got to be honest with your team if you don't have all of the information or if you don't have an answer. And I think, you know, in so many instances, you know, as leaders, we want to look absolutely knowledgeable and absolutely certain. And it means that you are a little bit vulnerable if you say, you know what, that's a great question. I hadn't thought about that implication of Agile. What do you think is the best, you know, response to that? Or how does that affect some downstream activity? And it's that kind of candor that really builds trust at the team level. And in moving through that kind of vulnerability, and we had those moments of vulnerability, and to Vicki Sadie's credit, and I think to our management team's credit, when we didn't have the answer, we were really good about capturing that information, following through, and then building it into our go-forward messaging. we're in the Agile process today. I think it is working effectively for us. One of the success criteria that the California State Auditor was looking at is the pivot to Agile, but also concluding our early phase requirements, which we did timely. And so we're encouraged that by integrating organizational change management into our project management processes, into risk and issue management, that we aren't treating them as completely separate entities and animals, but we're trying to look at them as an integrated whole. So as risks and issues develop and they create uncertainty at the team level, that we have a good organizational change management message to support. Why is that a risk? Why is it an issue? How, as a team, are we trying to address it? And sometimes they're leadership issues and sometimes they're technical issues, but they create uncertainty at the team level, and you have to have a communication approach to try and address that. So I think we're pleased with the early progress on Agile, but we have a long way to go in delivering the system. So I'm happy to take questions, feedback. Yes?
I think it's very interesting that you started a project and then your switch from waterfall to Agile became a sub-project of that, even though that sub-project had bigger ramifications than the original project. And how you handled organizational change management for that sub-project going to Agile, it dealt with all of those aspects of that.
Right.
Just as you're talking, I'm looking at the Honeyway, they did this, they did that, and continue to do it, you know, through the whole life. That's really awesome. Yeah.
Thank you, thank you. And it really took answering each of these questions initially, and sometimes we didn't have the answers, and then you had to have 100 more conversations to develop responses in each of the areas. And I appreciate you mentioning that, because one of the things I didn't tie to is the whole question of competence and comfort in terms of the knowledge base in the traditional waterfall life cycle. And so really smart, competent staff initially in Agile were frustrated, and it was so different in the term, people were using the same term and they meant two different things and they were talking past each other. And it took some time for folks to really build confidence in this new approach. And if we didn't have end-to-end organizational change management, I'm not sure we would have been successful. Other questions in the back?
You mentioned communication and conversations a couple of times, and I'm sure there were probably several hundred people involved in this and keeping the whole workforce informed. And we've become an email type of workplace now. What kind of things did you do to ensure the consistency of the message and the feedback loop, and what sorts of, did you use electronic media communication more, and what did the communication aspect?
Yeah, that's a good, so the question was around communication. One of the things we trended towards not using email as a primary communication method. Both Vicki and I felt strongly that we needed to have direct in-person communication given the nature of the change. So we had a series of all-staff meetings, a summit to talk about Agile, and it wasn't a summit to say, hey, this is what we're doing, deal with it. It was more of a conversation about, we think this makes sense, these are the reasons why, let's, give us some feedback on it. And then we really tried very hard to push our communications and materials down to the unit level as well. So we didn't think emails and posting to our intranet were going to be as effective as that direct interpersonal communication. Obviously, with some scripted information, so the message was consistent across the organization. One last question? Okay.
So it's very interesting that you use Agile to divide the big project as a small piece. And then kind of clarify the what, so you can answer how am I doing, because this small piece, you know how you're going. So
right.
I want to see how you guys divide the big piece of work and then the small one, and then each phase of each small project, how long it is.
Right. So the question is, how we started dividing up the work, excuse me. We always were going to have multiple implementations because we have huge systems. We have a pharmacy system that we're adopting, a product that our vendor Xerox is bringing aboard. So we'll have a number of subsystems that we implement over multiple releases. And then the big claims processing engine is implemented in our final release. But for each of those releases, we have sprints that we are building component parts. So we've made the decision to do 20-day sprints, so essentially one state work month, and in order to do both infrastructure development and we're also doing the software development piece in incremental chunks. So does that answer your question? Great. So thank you all.
Okay, I have 2 notes of housekeeping and one thing to give away to you here before I hand it back over to the team to tell you just a little bit more about the toolbox that you'll get as you're walking out the door today. The first thing is, as Brian was telling you, a lot of his morning talk was based on this book by Malcolm Gladwell, The Tipping Point. We have 5 copies to give away here, so if you'll turn to the very back page of your workbooks, if you have a card there that says congrats, you get one of these. Okay?
Oh, wow.
Yeah, that'd be great. All right, so hold your card up or your book up, and Brian will bring one around to you. And then for those of you who don't get the actual book, you'll hear more about what's on the toolbox before you leave here. Second point of housekeeping is if you're coming back for the afternoon session, please bring your workbooks back with you. You'll need those for the afternoon. I think that's essentially it. And you can take all your other materials with you, your 10 cards and your quizzes. So without further ado, I'm going to hand it over to Andrea and the team here.
So one of the things, first of all, how many of you are coming back this afternoon? Okay, so those of you that didn't raise your hand, why not? Just kidding. So we encourage you to come back this afternoon because we will have a toolbox available for you in the afternoon. Those of you that aren't coming back, suckers, you know. And the intent of the toolbox is so that you walk away with something that you can take back and now start using, right? I mean, the toolbox is there for you to reach in and say, for changing this particular, ceiling fan out. I don't know why I might use that one. Perhaps it's because I've done that this last week. But, I might need this kind of a screwdriver, right? You reach in the toolbox and you grab the right one and you use it and you change it. And if you grab the wrong one, it doesn't work. And so that's the intent of the toolbox, right? Is to have you leave here with little tidbits of pieces of documentation or strategies, as Bill talked about, an audit report, right? Why would we put an audit report in there? Because audit reports are full of really good information about lessons learned. There's, the ITLA, our IT Leadership Academy has put together an organizational change management readiness guide. That guide will be in that toolbox for you. There'll be some communication templates that I think will be very valuable or very useful for you to go ahead and go through and look at. And the thing to keep in mind is that, change management isn't something you start and you stop. It doesn't have a, let's start, you know what, today might be a really good day, let's kick off change management and let's start that today, right? It's a continuum. It's something you ought to be doing from the day you initiate any kind of concept or idea, and for the rest of the existence of the application. It never goes away. The other good thing about change management is that it's exactly that. It's change, right? So if you're doing something and you are beating your head against the wall and you're going, man, my change management isn't working or my project isn't working, it's okay to change something, right? That's the whole purpose of change management. So think about, as you're looking at the project you're working on, if there's something that you've been frustrated with or isn't working, or this toolkit, this toolbox that we're giving you, will have some things in it where you can say, oh, you know what, I'm here, right? I'm past this initiative. It would have been nice to know this 3 years ago, right? Way past that, we're here and I'm in the middle of hell. You know, somebody throw me a lifeline, and there's information in there that you can use from this point forward, right? It's not as though if you weren't doing A, B, C, you're on your own. You can pick it up and you can start at that D, E, or F. So important to note that. There's a reading list in there, some contact information, and then there's some reviews of some books, some excerpts from some books, some, you know, resources that we've all used, and they may sound familiar to you. Things like The Heart of Change, right? Who's heard of that? Right, yeah, it's great resource. Let Go of the Status Quo. Anybody heard of that? It's interesting. It's got some interesting information in it, a playbook for transforming state government. And the interesting thing about that is that a lot of these books are written from a very private sector perspective. This one really does have a state government kind of flair to it. So another, Organizational Acceleration, the New Science of Moving Organizations Forward. And then Global Human Capital Trends 2014, Engaging the 21st Century Workforce. Great book when you're talking change management in your organization, because few things are happening right now, right? We're not just, in some cases, introducing technology in places where we've never had it, but we're introducing new technologies in places where we have 20 and 30-year-old technologies. And we have people, right? Because at the end of the day, it's really about the people. But we have people who have been supporting that 20, 30-year-old technology, and we're now going to ask them to support something new, a new type of technology, a built-in, completely foreign language for many of them. So it's the other thing to think about. It's good information in there. Excited to have you all come back this afternoon. We will be here again. We will be with, I think, Delegata, right?
Deloitte.
Or Deloitte, I'm sorry. Deloitte will be joining us. So I'd like to thank Delegata for their participation this morning and for sharing some very good information with you in terms of you know, concepts and ideas to think about and evaluating where you are in delivering change. So thank you very much. So I believe with that I can release you for lunch. If you are here for lunch, we do have a very interesting noontime speaker presentation. If you are not, enjoy what you go and eat, and we'll see you back.